Good evening, everyone. This is Jen Freiheit from the Health Department. I thank you for having me again. Looking forward to giving you an update on the COVID-19 situation. I'll start with just the basics, the numbers, what has happened this week, and then I'll move into a little bit more about what we're doing at the Kenosha County Division of Health and what that means. So we sit right now at 14 positives. One was currently hospitalized, but I think they were released today. There are 130 negatives, and we sit on 278 persons under investigation or tests that we are awaiting results on. With each of those persons under investigation, we call them PUIs, we follow up with each of them and give them education as to what that means before they even get their test results, that they need to stay isolated or quarantined to home, and we answer their questions, that sort of thing. From those 14 positives, we have 114 contacts that we then follow up with. And this doesn't mean all the contacts from the beginning of the first positive. This just means current ones that we are following. So those contacts could be close household contacts that live in the same unit with somebody who has a positive case of COVID-19, or somebody who came in close contact with them through, say, work or some other close personal space encounter. That is where our numbers sit right now. I do want to say some really great news we had this week. Our county emergency manager, Lieutenant Horace Staples, was working with the state Wisconsin Emergency Management on getting personal protective equipment to the county. So I was not personally expecting it to come this fast, but it sure did this week. 4 in-home personal care agencies, 5 long-term care facilities, 5 emergency medical services, and 1 of our hospitals all received a small stockpile of personal protective equipment this week. And there is another survey that is going out in the next 24 hours. In fact, I just emailed it out today, but within the next 24 hours, another call for personal protective equipment is happening. So we should soon get more of that throughout the county for the people who need personal protective equipment. There's also some other efforts going on to collect, like you might have seen on the news, from private sources. And so people are being very generous, and we'll hopefully get all that PPE to the right people who need it as soon as possible. The governor just today signed order number 12. That's a safer at home order. It is not a shelter in place. I know we were receiving many calls about, are we in a shelter in place or not? This is not like what you're seeing in Europe where people are policing the streets so nobody can walk the streets. This is an order to basically say all non-essential functions should not be happening. That does not mean that you can't take a walk. That does not mean that you can't get outside for fresh air or go to the grocery store. Those are all essential things that we need to be able to do. But it is a very detailed order. That was an email I also sent out today, or you could find that online, that the governor has put out to really clarify what that means and who should be open and who should not be. So I won't go into too much detail about that. You can certainly see that. And then I just wanted to clarify a little bit of the science behind COVID-19. So there are several strains of coronavirus, and some of these strains are what cause the common cold that each of us gets annually. And there are other strains of the coronavirus that cause viruses such as SARS, MERS, and this COVID-19 virus. So again, the best measures to avoid the spread are to stay home and to practice good hand hygiene and practice social distancing. So based on epidemiologic modeling, the best scientific predictions we have at this point through a Harvard epidemiologist and other researchers predict that within the coming year, 40 to 70% of people around the world will be infected with the virus that causes COVID-19. This is not a scare tactic. This is not to say that everyone will have a severe illness. Many will only have mild symptoms, and some will show no symptoms at all. We are seeing some positive cases right now that are asymptomatic. And given that there is already community spread, We were one of the first counties. Our very first case was a community spread, meaning that there was no travel associated and no contact with a known positive. So we can assume that some of the community may already have it and may never get the typical symptoms associated with it, yet have the ability to spread it. And due to the low numbers of tests that are available, it's hard to pinpoint just how much might be out there because very few tests are being run as compared to maybe some other countries. So in the local health department, we are meeting in our emergency operations center. The emergency operations center is right in the health department. And without this strong data to sort of say what are the hot spots and what is the epidemiological linkage and what neighborhoods are we seeing it, it's hard to sort of pattern out with just 14 positive cases because those were only the 14 that were tested. We sort of said, well, what is our vision? And our vision is immediately to start flattening the curve. And our long range vision is to really get back down to 0 cases, 0 spread, and as minimal fatalities as possible. And our mission to do that is through 3 things. One is through education of the community, education of the residents, both those who are positive and negative, and employing containment measures. That is our mission number 2. The containment measures involve the isolation or quarantine of those that are ill or those close contacts at home. Things like social distancing is also a containment measure. Hand washing, masks, those sort of things are all containment measures. Our third mission is relationships with partners. We have found amazing relationships in this time, this difficult time with all the partners in Kenosha County. And we're working to increase that communication and increase those relationships. That this week in particular is one of our strong goals to be able to do that this week. We worked very hard on, the first 2 weeks of this response, the first 3 weeks of this response, we were in an all-out sprint as a health department, trying to contain it, trying to do all the tools in the toolbox, use all the tools in our toolbox to contain it. And we're in this for an ultra marathon. So we really had to reevaluate our processes in the health department this week to say, what do we need to do to stop the sprint? Because we need to be able to sustain our staff and sustain ourselves to handle this for the long haul. And so that is where we needed to revisit the vision and mission, realign some of our workload and our processes so that we aren't burning out staff and working the long hours that we have been working as we simply tried to grasp an understanding of this novel virus. So we did receive a question this week, and one thing I would like to share is the question I was asked is, what does public health do? And what does a public health office look like? And that really gave me pause for a minute to step out of the internal world of public health, that the external world doesn't really know what public health does. And so I just want to describe a little bit, as I described, our public health department, we have 3 clinics, and but they're not the kind of urgent care clinics that you go to when you're sick. They're more clinics for the well, or how we keep people well. But our office looks like just any other office. There's cubicles and offices with windows and doors and conference rooms, and our public health nurses are literally sitting in these cubicles and offices and meeting in the conference room and training other nurses on how to handle contact investigations, for example. And we're constantly in huddles to determine with every unique case what we need to do, what decisions we need to make. And so there's constant communication around the clock through all the channels necessary to ensure that we're containing this and educating back to our mission as much as possible. So I just wanted to run through a little bit an example to try to show what public health nurses are doing, what we are all doing in the health department, because it is all hands on deck, not just our nurses. But for example, Sunday we received 3 positive cases, and that's on a Sunday. It was later in the afternoon, and we're statutorily required through communicable disease statutes to follow up on any Category 1 communicable disease. So this is not something that can wait till a Monday morning. We have to begin calling those people that are positive, talking to them about what it means to stay at home, talking to them about their household contacts and if they're having any symptoms. And then we start that big investigation, asking where they had been since the 2 days before they started having symptoms and up into the very current point. We gather all of that information, what store, what restaurant, what school, what workplace, who were they in close contact with, or who might have they just passed by in the hallway. And it requires a lot for those new positive cases who are experiencing anxiety. And we really take the time to educate them and walk them through that they literally are looking at their calendars and looking at their contact book and giving us the phone numbers and the names so that we can then reach out to all of their contacts so that we can then have them quarantined at home or see if they have signs and symptoms. So as you can imagine, this is a very long process. For each positive case, it takes 2 nurses to begin this initial investigation. And then we have a contact investigation team of 16 people that then follow up on those dozens of contacts that come out of each positive case. So it's a whole lot of time on the phone, educating, allaying fears, calming the public down, who have now received, this potentially scary call from the health department saying that you've been in close contact. And we walk them through all the things that they need to do. We have been delivering thermometers to homes of positive cases that don't have a thermometer, because one of the things we ask them to do is to take their temperature twice a day and call us back if they have any increased signs and symptoms. And we have been sending them via email materials on what it means to isolate at home and providing them as much education as possible. They're often calling back. We have gotten calls back from close contacts who were asymptomatic at the time we talked to them, and then they started getting a fever, they started getting symptoms, and they called us back exactly as they should. Sometimes I shouldn't even say sometimes, it's almost on the hour, we're talking to the hospital's infection preventionists and letting them know what's happening with the contacts we're talking to. They're letting us know what's happening with the people they're testing, and there's constant communication back and forth about what we do about various cases and what's happening. And then we're communicating that out through press releases, through the many phone calls we're getting to the health department. So a lot of hands are going into each and every positive. It takes, generally, depending upon the size of the case or how many contacts they had, it takes anywhere from 4 to 7 days to completely get through a contact list and make all of those calls and educate people and the callbacks and checking their temperature and checking for signs and symptoms and getting them the information they need so they can be comfortable at home, the resources that they need now that they are quarantined or isolated to home. So if you can imagine this office with about 40 people that are answering phone calls, huddling together, making sure we're on message, in addition to this fast and furious pace of what's coming out internationally, nationally, statewide, constant changes, such as I talked about last week with the tiers that the state lab is now testing for. And the testing has been the question of the week. We don't have the public's test results. They have to call their provider or the institution where they got the test to get the results. And so it's a lot of reaching out. So far, we're reaching out to every single person that's left us a message or left us an email or a website form filled out, and we're making that contact because, like I said, our critical mission is education. So we're taking the time and staff who have abandoned their other public health duties to handle this COVID response and make sure that we're really doing our due diligence to talk to the entire community and let them know what's going on, try to dispel the rumors. We have a team of people who are monitoring Facebook and the media to sort of see, what is being said, what is the fear out there, so that we can answer that in our next press release per se. So those are really our critical mission areas that we're trying to use containment measures, partner relationships, and education to decrease the spread and decrease the number of cases we do have. So I'm going to look, that is my intro for the night, but I'm going to look to see if there are any questions that have come to me, and I'm seeing a note that there are no questions. I'll give it just a minute in case somebody wants quickly to type into Sean with with any questions, but again, I just want to say our partners have been amazing. Everybody is jumping in and helping to mitigate this. Your public health staff in the community is knocking it out of the park, and they really are amazing. They're the behind the scenes heroes. I know we hear, you know, and obviously we have all the heroes in our first responder world and in the hospitals. And I just want to make sure that we include our public health heroes in the background, because they really are the ones containing and mitigating this behind the scenes that nobody hears about. So I thank you for this time to let me tell you about them and all the good work that they're doing to keep Kenosha County safe. And I'm still not seeing any questions. So with that, I thank you for tonight, and I'm assuming we'll probably talk again very soon. Thank you.